Okay. So, yes, just a sec. Perfect. So, hi everyone, and this is the famous Dil Se session of Doc, where usually one faculty talks heart to heart with the other faculty, just casually, just to know his or her perspective about everything. So, for today's chat session, we have one of the most popular radiologists with us, Khaleel sir. So, Khaleel sir, welcome to the chit chat Dil Se session.
Thank you so much, ma'am. And it's nice to connect with you after a long time. And I think this is the right time to connect with the FMG students, also very close to the FMG exam.
Absolutely, sir. The exam is so close now, and there has been so much anxiety among students. कि अब last month में what should we do and how should we prepare? That's something which I am getting that queries again and again. So who can be a better person to answer than you?
Yeah, ma'am. Yeah, ma'am. I think, this last month, the students have got enough time this time. Okay. So I think, most of the students are prepared. It is just about controlling their nerves at this moment, not going behind a lot of new content or new things. It is about solidifying what all concepts they have already studied, and more of recalling whatever they have studied, and improving their mistakes rather than trying to do a lot of new content. So if somebody can consolidate whatever they have done all these 4 5 months, I think they are on the right track. And this time it is not going to be more of a academic thing. Right now it is more of a mental game now. So a lot of work is already done, a lot of studying is already done, a lot of questions have already been practiced. Somebody who can manage their nerves at this crucial moment is going to go in and do a good exam and come out happily out of the exam. And ma'am, your perspective, like in the last month, what would you suggest?
You are absolutely correct, sir. I think this is the time where we have to control our nerves and just focus and consolidate whatever we have read. So it's absolutely correct strategy to follow. So perfect, sir. Sir, so one of the major things that students say is that some students have lost the exam last time by 1 mark, 2 marks. So they are saying कि इस बार होगा कि नहीं होगा, क्या ऐसा पिछली बार हुआ कि I was not able to crack. So some motivation for such students who are very low at this point of time.
I think, ma'am, everybody eventually clears this exam. So having hope that good things will happen is important. I have seen students, batches. Maybe initially, very few students may pass out, but going forward in the consecutive exams, people do clear. So uh, you have got 6 months to actually rectify those mistakes, to improve on those mistakes. And the mistake now would be to spoil this 1 month, thinking about what wrong could have happened. Why don't we think about what good could happen? You could actually score well. You could have, last times कई सारा टॉपिक्स आपने कवर किया होगा, इस बार और ज्यादा न्यू इन्फॉर्मेशन आपने गैदर किया होगा. So there will be higher chances of you doing right rather than wrong. So comparatively, every attempt, people become improved. I have seen students not studying at all, coming back to India, putting some effort, taking some time. Everybody, when they start late, it takes some time to get the concepts, to get the knack of solving the MCQs and all. But eventually, people do well. So having that hope that yes, from compared to your previous time, and deep inside, most students know that compared to last time, इस बार उनके कितने सारे subjects improve हुए होंगे, कितने सारे concepts clear हुए होंगे. तो deep inside you have to back that feeling rather than keep on worrying about it. जिस तरह से हमारा hope रहेगा उस तरह से हमारा effort भी रहेगा. तो अगर आप सोचोगे कि अच्छा एग्जाम होगा, I'll do really well, most of the topics that you see in this last month will actually come on the exam, you will give yourself that kind of inputs, that kind of actions that will end up into good results. तो लेकिन अगर आप you keep thinking about wrong things to happen, it unnecessarily drags you down. So I think a lot of good time you have got. Last 1 month still is left over. There is enough scope to improve, and if you have missed out marginally, this is the time to do really good and come out of it. Yeah.
Absolutely, sir. So the two major queries that I'm getting now is one, GTs देने चाहिए last month में कि नहीं? That's the first question. And the second, which are the five top subjects which they should focus now so that they get the maximum yield?
I think, ma'am, if somebody has not done PYQs, this is the time to, move away from QBank and shift towards PYQ. This is not the time that you run behind doing lot of new questions, telegram questions, lot of random QBanks and all. You are preparing for an exam. This is the time to consolidate your PYQs. If you have missed out any NEET PG PYQs, please solve them. Some relevant INI CET questions you feel that could come up, you please go through them. Don't go into too many unnecessary details. Standard questions will come, routine questions will come. See that you, if you want to add one or two more papers, if you have already done last 5 years PYQs, please add up more PYQs rather than going for new questions and all. And as far as GT is concerned, yes, you need to keep that momentum, that knack, that stamina, even on the day of exam. So I think there is still time to do two more GTs. Maybe 10 days they can plan it out, so that they maintain that rhythm, and not be judgmental about the results. Now, this is not the time to judge. I have seen many students not doing really good on GTs, ending very nicely on the exam. So rather than with a माइंड दैट ओके, अगर जीटी में कम आ गया मैं डिमोटिवेट हो जाऊंगा, मैं उस दिन खराब कर दूंगा, नेक्स्ट डे पढ़ाई नहीं करूंगा, ऐसा रखना ही मत है। कि आप देखोगे कौन से टॉपिक्स आपके वीक हो गए, कौन से टॉपिक्स, एंड यू शुड बी हैप्पी इफ यू डू सम मिस्टेक्स from standard topics, so that you can rectify yourself. The whole idea is to get that analysis. So in a very positive approach, you approach GT. Okay, let me see what all topics I am not able to recollect. And don't do random. Don't worry about random questions. Some topic that you feel that you should have known and you have skipped that, please emphasize on that. It is a time to recollect all of that. So do two GTs. That is would be my suggestion at this point of time. And the five important subjects that you have asked, ma'am, I mean, I think at this point of time, OBG, PSM, and patho, pharma, micro, I think these are standard subjects which students should emphasize on. And at the same time, it is good time, if you have already studied from last 5 6 months, I think make effort to revise all 19 at this point. हो जाएगा, एक दिन में भी करोगे, कुछ सब्जेक्ट्स हाफ डे में अगर आपने एक पढ़ रखा हुआ है, you ऑलरेडी स्टडीड सो मच दैट इफ यू गिव, किसी को लगेगा कि सर मेरे को आप एक हाफ डे दे दो, मैं फॉरेंसिक निकाल दूंगा, मेरे को एक दिन दे दो, मेरा ईएनटी हो जाएगा, तो डीप इनसाइड योर प्रिपरेशन, सो बैक योर सेल्फ अप. इट इज नॉट द टाइम टू narrow down completely, but at the same time emphasize on some important high yield subjects. Don't miss out on OBG and PSM at any cost at this point of time.
Absolutely, sir. And also small subjects, they you should be thorough with them, because उसमें से repeated same questions are asked nearly all the time. So at least वो तो आने ही चाहिए. So these also, मतलब you should at least go through the repeatedly asked question जो कि smaller subjects से आए हैं. So they are very high yielding, and if you mark them correct, immediately your score improves. Right, sir?
Yes. Agreed, ma'am. The trend in FMG for your short subjects has been routine, repeated standard questions, scoring questions. So even if you flip through once at this point of time, the chances of you doing really good on the day of exam improves drastically.
Yeah.
So you are not going to get lot of rare questions and stuff in any of the short subjects. Usually it's a scoring subject. So एक बार recall कर लेना important होता है. In this 20 days time that you have, it is important that you flip through the pages once, right? You get that clarity about those short subjects. The score actually improves drastically. Don't ignore short subjects. Subjects like radio can actually integrate a lot of other subjects, make you have a good integration. Now that you have already done all the subjects, now the clarity of the subject, the integration of the subject improves. So don't ignore on doing systemic radiology at this point of time. Yeah.
So, sir, once you said that, just tell any top important topics from the radiology which students should not miss before going to the
Yeah.
exam.
Yeah, ma'am. I think radiology is heavily tested in the exam. Every year, the FMG paper touches around 15 to 17 questions of radiology. This year also, you will have a lot of weightage. Even in NEET PG, we have a lot of image-based questions. So the trend is towards this thing. So if you are spending some time to complete radiology, the workbooks that have been provided to you, the clarity of those images and all, just go through those ones, the image files that you have. Some topics that I mentioned is, go through trauma. Trauma is something that is heavily tested with imaging. Like you need to know all the types of intracranial bleeds. You have epidural, subdural, subarachnoid, how they appear, pneumothorax, look at pneumoperitoneum, have an idea about emergencies also, like acute aortic dissection, acute pulmonary thromboembolism, the radiograph findings, the CT angio imaging, and also acute abdomen, how volvulus appears, how interstitial obstruction appears, how to differentiate large bowel, small bowel, perforations, right? How to identify the radiological signs of perforation. Then I would say some important diseases that routinely are tested, like TB, like chest radiograph findings of miliary TB, the apical area involvements, and also there is a trend of radiotherapy and nuclear medicine being tested heavily on the exam. It's a small effort, but gives you easy marks. If you just look at the table of radiosensitive and radioresistant, if you just look at the table of radiosensitive tumors, radioresistant tumors, the table of what tissue or radiosensitive, every time you get one question on that.
Mm.
Radioisotopes, some really standard radioisotopes. SESTA may be such a frequently asked question in the recent exams. MIBG scan, SESTA may be scan. Just go through them. How which isotope for Meckel's diverticulum. So some nuclear scans also. But these are very less effort. But you can be assured about one question on the day of exam from your radiology. There has been questions on fractionated radiotherapy. Give an idea about what all types of different radiotherapy models are available, what is teletherapy, brachytherapy, isotopes used, and also concentrating on the standard classical things. Every year they have been asking about identifying the procedure. Just they give you mammography image, they want you to know it is mammography. Standard images, IVP image, MCU, how does RGU appears, how a PET CT appears, how a PET MRI appears. Simple ones, easy questions to catch there, right? Easy marks to catch there. Just brush up these things before, I think you'll have a good score. And some classic radiology signs and radiology images that you all must be knowing, how the different heart appearances of cardiac shadows would appear, the figure of eight appearance, the snowman appearance of the heart. You also have the boot shaped heart. All those appearances of heart you can look at once. And I think pretty much this thing, uroradiology, you will get one question, uretrocele, or IVP image, like that. So horseshoe kidney is a routine question that you have there. So these are some areas that I feel, if you can focus, you have higher chances of scoring well on the day of exam.
Absolutely, sir. So I always remember sunburst appearance and soap bubble
Yes.
appearance in the bone
Yes,
tumor.
yeah, you reminded me about that. The bone tumors part, exactly. Both in pathology and radiology, I think those appearances of standard bone tumors, even the routine. And at this point of time, students should go for something which is very very routine, rather than trying to go for a
Yeah,
lot of details. Simple bone cyst, appearance of GCT, appearance of osteosarcoma, Ewing sarcoma. So go for the routine standard ones. This will give you good marks, good scores also. And also, ma'am, there are some students, I think they also have joined us live. And one student is asking, sir, INI CET PYQs kar sakte hain. What would your opinion be on this, ma'am?
okay, any PYQ is important. I still remember this. Uh, it was an FMG question and it came as a hexanucleotide repeat. Sir, I hope you remember that question.
Yes.
I was shocked at looking at that question. That hexanucleotide repeat question is coming as an, because FMG is a screening exam and you don't expect this question to be there. It is not even an INI CT level question. It's even tougher than that. So I think the papers are always intermixed. So INI CT questions can come in FMG, NEET PG questions can come in FMG, FMG questions can come in NEET PG or INI CT. So it's all intermixed basically. So if you have time, so first you should finish your FMG all PYQ. If you have time, then finish NEET PG. If you finish NEET PG also, then why not do INI CT also? So it always give you a edge over the others. So it's always good to do as many PYQs as possible rather than doing random new questions. So that is one thing which I always suggest.
Agree, ma'am. And ma'am, patho also is a diagnostic subject, such a vast subject, and especially close to the exam. What would your advice be in completing patho, and which areas to focus in patho, ma'am?
So, if you look at the past 5 year FMG PYQs, and you can easily interpret the pattern of the exam questions that come in pathology. Like there'll be always be one question from apoptosis, pyroptosis, necroptosis, or ferroptosis. So one question definitely will come from there. Second, autophagy is a topic which they have started asking recently, so they can ask you that. Third, chemokines and cytokines, so they can ask you that. Or positive acute phase reactant, negative acute phase reactant will be usually asked. Hypersensitivity reaction, koi na koi ek hypersensitivity reaction will definitely come. Then amyloidosis question, always every alternate year we have an amyloidosis question, which is usually asked. Then coming to the next, so there'll be one gene which will always be asked. It can be retinoblastoma, it can be Wilms tumor. So they can ask you, this is the tumor suppressor gene or oncogene, Burkitt lymphoma. So one gene will always come. Then syndromes, Down syndrome, Klinefelter, Turner's, a question definitely aata hai. So either they'll give you Down's, Turner, Klinefelter, or they will give you Gaucher's disease or Niemann-Pick disease. Definitely आना ही आना है. So syndrome and these syndromes should be well known. One pedigree. So either they'll give you a pedigree or they'll give you PCR. So what are the steps of the PCR was a question, or they'll give you one pedigree and they'll ask you what can be asked. Okay. Then ek, either they'll give you anemia, that can be simple as iron deficiency anemia versus thalassemia, or they can give you anemia of chronic disease, which is now called anemia of inflammation, or they'll give you leukemia. So hemat may either anemia or they'll give you a leukemia, and leukemia also acute or chronic leukemia can come. Recently I've seen a trend towards asking ITP questions, so be very clear. ITP questions can be asked कि thrombocytopenia idiopathic fever हुआ बच्चे को, उसके बाद thrombocytopenia हो गया, क्या हो सकता है. Okay, so remember they ask you first line of therapy for ITP. It's always steroids. So this kind of question that they're asking. In systemic pathology, renal cell carcinoma should be asked, should be revised well. Bone tumors, abhi sir ne bataya, same. We have to know these bone tumors, which should be very very well known. Apart from that, men syndrome आना चाहिए, कुछ ना कुछ पूछा जाता है. Pheochromocytoma, usually the questions asked. Apart from that, techniques में vacutainers and order of draw आना चाहिए. कोई ना कोई वैक्यूटेनर जरूर आएगा. EDTA, heparin, anything can come. वैक्यूटेनर अच्छे से आना चाहिए. And how do you draw the blood, वो भी आना चाहिए. So these are common, and one stain will always come. Either it is a pus stain or they'll give you fungus and they'll ask you aspergillus hai, pneumocystis hai. This will definitely, one question from stains will definitely come, or Masson trichrome for collagen. कुछ ना कुछ stain जरूर आएगा. So more or less the paper will revolve around this only. So these topics should be known very very well before you enter into the exam hall.
Yeah.
That's all, sir.
Mm. And ma'am, at doctorals, they conducted this All India FMG mock test also, and the students were putting in the chat box that a student has got 137 marks. How can he improve now? And another student has got 166, and he's asking for suggestions to improve. What would be your advice beyond that, ma'am? Somebody who's getting around 137s in the GTs at this point of time.
So this is the same question which I asked you in the starting point only. Ki agar, suppose if you are little behind the others, the only thing you need is the final push. So basically, what is the push? You have to just know the topics from which the exam can be asked. You have to know those topics well. For example, agar seminoma hai, so every alternate year it is coming in the exam. You know that, so you cannot do anything wrong from seminoma. You have to know that topic. So remember always, exam is not about knowing everything. You can't know that. Exam is about knowing the things that can be asked. So they're limited. You just have to focus on those limited things, and your teachers usually keep telling you these are the things that can be asked. Focus on that. So if you're getting 137, that means कि थोड़ा सा push चाहिए. So just analyze your mistakes. What was wrong? And focus and revise your mistakes. Ultimately you will cross that cutoff point, and I'm sure you will be successful.
True. I think it is about analyzing those mistakes, and rather than panicking at this point of time, this is a good time to relook into those mistakes and improve on that. And as rightly said, ma'am, the students should know how to focus. अभी क्या होता है, पूरा workbook लेके बैठ जाते हैं and they don't know like way to slow down and way to focus. एक speed, जैसा you start with some subject, there's a lot of anatomy, a lot of physiology before you actually come to diseases. So you should know where to speeden up, where to focus. By doing your PYQs, by knowing the topics that have come, you already know. By this time, I hope that you have done so many exams, so many tests. You already know which topics are high yield, which are asked in the PYQs, which are in the exam focus. So when you're studying, you should be able to skim through the topics so that you get an understanding of it and focus and slow down on the high yield areas. So if by this you can cover a lot lot and in a very fast time also, and in a very large amount of syllabus can be covered. Even big subjects can be covered very fastly if you have a scanning approach and a focused approach where you want to slow down, where you have to speed it up. I think you will still go with that confidence. So try to achieve as much of fresh memory of all your 19 subjects very close to the exam now. So जो भी 19 सब्जेक्ट्स आप पढ़े थे, एक बार फिर से अगर आप देखने की कोशिश करोगे, तो वो कॉन्फिडेंस एग्जाम के दिन अलग ही रहता है. तो इफ यू हैव स्टडीड समथिंग नाइसली, इफ यू कैन रियली पुट इन सम एक्स्ट्रा एफर्ट, be very very disciplined at this point of time, don't let any negativity creep in, give your 100%, and all efforts done now will have very 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 huge benefits going forward. So put in your 100%, put in your heart and soul into this, and do this very very aggressively. I think you're all done by now. This batch have got 2 months more compared to the previous batches. They've got some extension of the exam also. I think it's a pretty good time for these people to revise also and get a good scores also. And any last advices, ma'am, from your side?
The last advice is the only thing. If you're not distracted, you will be a winner. So this is the time when you should not get distracted. You should focus, be disciplined, and believe in yourself. Don't get anxiety, tensions that I will what will happen if I will not get this. Don't think about it. Be disciplined, be focused, and believe in yourself. That's all. These are the three important mantras before you go for any exam.
Yeah, ma'am. Thank you so much, ma'am. I think we'll keep connecting with our students again, very close to the exam also. And a lot of students are messaging that they have done CPR from Dr. Trials. I hope that acts as a huge boost to your preparation. Add in a lot of MCQs with along with that, and you should be well sorted for the day of exam. And go in very positively. Revise your main workbooks as much as possible. Give focus on your main subjects, as ma'am has already emphasized on. Emphasize those topics. Ma'am has spoken about patho topics. I have explained you some amount of radiology topics that you can go through, and go positively into the examination. All you should do well. And I think PUBG, which question you're asking? Sir, I'm reading CPR notes again and again. Should I stick to it or go through my main notes once again? Ma'am, any advice on that?
So I think CPR was basically designed to tell the most important questions that can come in exam. So it was actually, you can say that it was the gist of everything that can be asked. So if you're very thorough with CPR, that means if you're sure that you will not do anything wrong from CPR, I think you are 80% done. So most of the questions will come from that. But yes, if you want to be in that top league, 20% bhi aana chahiye, then yes, you can revise your notes if you have that much time. So that was the purpose of CPR. Was the only purpose of CPR was to give you the gist and the most important questions that can come in exam. So if you're done with that, and if you want to excel more than that, then yes, you can revise your notes. That's what I feel, sir. What is your view about it?
I feel the same, ma'am. CPR will give them all the important high yield areas, which they if they are not able to sort it down, okay, which are important, which are not important. I think CPR is a good source where the most important topics have been accumulated. You can go through that and feel content about that subject. If you have not yet done it thoroughly from your main workbooks and all, this is a definite short term remedy that you can rely on, and go into the examination hall, get it done, and move forward. Right? So I think that should be a good resource to believe in. And please add a lot of PYQs, lot of question practice to boost up and add on to that CPR notes of yours. Yeah, ma'am. I think thank you so much, ma'am, for connecting, and it was nice having you all and interacting with all the students at this point of time. And hope to see all the students doing well in the FMG exam
Yeah,
coming soon.
I'm sure all of you will come out with flying colors, and believe in yourself. And sir and I are always there. And in fact, all the faculty of Dr. Tutorials are always there to mentor you and to guide you whenever you have any problem. You can reach out to us anytime you wish to. All the very best, guys, and just believe in yourself.
All the
Right,
best,
right.
everybody. Thank you so
But
much, ma'am. Take care.
thank you, sir.